Hello and welcome to Health Matters on Channels Television. I am Mary Alale Yusuf. Dementia is a syndrome, usually chronic or progressive, caused by different brain illnesses that affect memory, thinking, behavior, and ability to perform everyday activities. There is a lack of awareness and understanding of dementia in many countries, resulting in stigmatization. According to the World Health Organization, the total number of people with dementia worldwide in 2010 was estimated at 35.6 million and is projected to nearly double every 20 years to 65.7 million in 2030 and 115.4 million in 2050. The total number of new cases of dementia each year worldwide is nearly 7.7 million, implying one new case every 4 seconds. My guest today in the studio is Dr. Njideka Okubadejo. She's an associate professor at the College of Medicine, University of Lagos, and consultant neurologist, Lagos University Teaching Hospital, Idiaraba. She'll be throwing light on the subject of dementia. You're welcome to the show, Dr.
Thank you, Mary.
Now, dementia, is it restricted to old people?
No. Dementia affects predominantly old people. However, sometimes dementia does occur in people who are younger. So when we say old people, we're talking about people who are over 60, 65. But sometimes dementia does occur below that age.
Is it then a natural progression of growing up? Is it something that everybody needs to expect to happen?
Absolutely not. Dementia is not synonymous with normal aging. Okay. Even though people assume that as people get older, they should become or develop dementia, both are not synonymous. So you have people who age healthily and do not develop dementia, and then you have some people who will develop dementia as they get older. So they are not synonymous.
Okay, so then what causes dementia?
Okay, first of all, let's look at what dementia is. Dementia is a brain disorder. The main problems with dementia are that the person who has dementia has problems with memory, like you said, has problems with thinking, and then has problems with communication, and like you highlighted, problems with behavior, social interactions. But these changes represent a decline from how the person was functioning previously.
Before, yeah.
So it's not someone who from childhood has had these difficulties, but this is someone who has been healthy otherwise, and then this change or decline, such that the person is unable to perform their normal daily activities without assistance. So that's the group of people that we're referring to who have dementia. Now, there are many things that cause dementia. We look at dementia as a disorder that can be caused by things that are reversible or treatable, and then caused by some other brain disorders that are not treatable. In other words, that are progressive.
Okay.
The progressive dementias that are not treatable are by far the commonest.
Okay.
So more than 70 or 80% of people who have dementia have those progressive, non-reversible dementias. And then a small proportion have dementia that can actually be treated and reversed. So,
okay,
for instance, dementia can be caused by certain vitamin deficiencies. Dementia can be caused by a thyroid gland that is not functioning optimally, what we call hypothyroidism. Dementia can be caused by accumulation of fluid within the brain, a form of hydrocephalus that is amenable to surgical treatment.
So all these are reversible?
All these are reversible dementias.
Of course, if you treat the underlying cause of the dementia,
then typically the dementia will reverse and the person will revert back to at least normal, sometimes completely normal or sometimes near normal.
Okay, so you've already highlighted some of the reversible types, like vitamin deficiency and
normal pressure hydrocephalus, yes, hypothyroidism.
That hydrocephalus, that would be in children, wouldn't it?
Actually, hydrocephalus can occur at any age, but we often identify hydrocephalus in children because their brain is still growing, and so the head size increases, so it's easier to identify in children, but adults do develop hydrocephalus from a wide variety of causes.
Okay. These dementias, like, we say it's a syndrome.
Right.
That means there are different types, right, that cause dementia. What are these different, headings, should I put it, or subheadings of dementia?
Okay. So if you want to look at it from the point of whether treatment reverses it or not, we talk about reversible or irreversible dementias. We also talk about progressive or non-progressive dementias. But by far the commonest grouping is Alzheimer type and non-Alzheimer type dementia, because Alzheimer's disease is the commonest cause of dementia and usually accounts for more than 60% or 2/3 of cases of dementia.
So non-reversible
dementia. Yes.
Okay. And then some others.
Right. So the other, apart from Alzheimer's disease, there are other causes of non-reversible dementia, like vascular dementia. So people who have repeated strokes, either strokes that were manifested clinically and somebody knew they had a stroke, or even silent, quiet strokes can accumulate and give rise to dementia. And then the other less common but irreversible dementias, there's a condition known as frontotemporal dementia, where they have behavioral changes with the dementia. Okay. There's another condition known as dementia with Lewy bodies, which is somewhat like Parkinson's disease, but their main feature is dementia. Parkinson's disease itself can also cause dementia.
Okay, so Parkinson's isn't dementia,
no,
but it can lead.
It can lead in the later stages to dementia.
Okay. Now let's look at the symptoms, some of the symptoms of dementia. What does a person with dementia, how does it look like? How does it behave? What happens?
Okay, I think one of the earliest things that someone with dementia will either notice or will have pointed out to them is problems with their memory. So let's address that a bit. The person typically becomes forgetful repeatedly, and it's that repetitive forgetfulness that becomes an issue. So I've forgotten where I kept my keys, I can't find my bag, I can't, if you tell me something now, I have to keep asking, repetitive questioning. If you answer a question, the person asks you the question all over again. So that difficulty,
and that's very common with older people.
That is common with older people. The problem is when it becomes repetitive, and when it becomes to a point where it begins to interfere with their normal functioning, such that they are not as competent as they were previously, then that highlights that there might be a problem going on there. The problems with thinking include things like doing a task, planning a family meeting, planning going to the bank, for instance, and forgetting to take the checkbook, planning to organize a meeting but forgetting the details, planning to go somewhere but not remembering where exactly you're supposed to go, opening the fridge, for instance, and forgetting what you came to do.
And some of these things strike me as things that affect even younger people, normally. And, a few people have said, I forgot what I was coming to do here, and then retrace their steps and suddenly remember, okay, I wanted to take milk from the fridge. It happens to younger people.
It does.
Do we call that dementia then?
No. So it's there are two things you notice there. It's the ability to almost quickly recall what it was you were doing, okay, the ability to retrace your steps and start from the beginning. And sometimes when you then go back, you realize, okay, this is what I was going to do. Right. So the person who's developing dementia, even that ability to retrace steps and figure out what it was is missing. And then it begins to interfere with normal functioning. In fact, we do not label a person as having dementia unless those problems with memory, thinking, communication are affecting the ability to cope with activities of daily living, normal functioning, grooming yourself, caring for yourself, dressing, going out, handling your banking.
They begin to develop problems with even grooming.
Yes.
Combing their hair, getting dressed,
yes,
having a bath.
Yes.
And what would you call the behavioral changes?
Problems. Okay, these behavioral changes can be quite disruptive. So it can be something as subtle as just somebody's personality changing. So becoming more irritable, becoming angry, a bit irrationally. Sometimes it's also behavioral changes like being paranoid, suspicious of other people's motives or activities, repeatedly accusing others of having ulterior motives, like wanting to do away with you and so forth. So those types of disruptive behaviors, not trusting people and so forth. So therefore locking yourself in a room repeatedly.
Okay, now, it's beginning to sound like the kind of cases people term as, he's going bonkers, he's going mad, something's wrong with him, his head is not correct. Are these some of the people generally refer to as mad people, for example?
In fact, one of the issues is that many patients with dementia, first of all, will be taken to a psychiatric hospital. Because typically, because psychiatrists are trained in neurology, recognizing neurologic diseases, I really don't see that as a problem, because when they do end up in a psychiatric facility, the psychiatrists are trained to be able to differentiate between disruptive behavior from dementia and disruptive behavior from other psychiatric illnesses. So it's not really that problematic. It's because of this type of association with mental health, other mental health issues, that they may end up being assumed that they have some psychiatric disorder.
I can see that you're carefully avoiding the word mad.
No, we don't use the term mad. My psychiatric colleagues will have my head.
So it's psychiatric disorder. Is this disorder hereditary? Is this something that...
Dementia.
Yes.
Dementia can be hereditary. So in a very small proportion of cases, less than 10% of, for instance, Alzheimer's disease, they may have a family history. And sometimes it's such a strong family history where every generation there's somebody that has dementia. But that represents a very small proportion.
About 10%.
Maybe 5 even. Very small proportion.
Okay. Now, we are saying that this person, we don't use the term mad, and it's different from other psychiatric problems.
Yes.
But it's irreversible. What's happening in this person's brain? What's taking place?
Okay. So with normal aging, nerve cells begin to die off. That's normal aging, but at a slow rate and fairly well distributed all over the brain. Now, depending on the type of dementia, but let me use Alzheimer's dementia, for example, there's a specific loss of brain cells in particular areas of the brain, particularly those that have to do with memory function. And it's at an accelerated rate, more than you would explain.
Okay, that's why it's not really tied to age per se.
Yes. So if you look at the brain of someone who has had Alzheimer's at autopsy, for instance, you find specific changes that are linked to the disease. We talk about certain pathologic changes in the brain that are not normal aging, and that are in specific locations of the brain that have to do particularly with memory.
Is there anything that triggers off these changes in the brain specifically, or the cause is unknown?
Actually, for now, we do not know what causes Alzheimer's disease, dementia, because, there are some clues, maybe some environmental exposures.
Okay, I'm going to have to ask you to hold that thought.
Okay.
We're going on a break now. When we come back, we'll continue from there. Welcome back. It's still Health Matters, and the number to call for your questions and contributions is 01-2206-842. That's 01-2206-842 for your questions and your contributions. And back to the conversation. We were talking about specific triggers that may cause these changes in the brain. Are there such things?
Actually, for now, there's no known cause of Alzheimer's disease. And that's the story for many of the non-communicable diseases. We do not know what causes them, but we suspect that there's an interplay between environmental factors, which are not clearly defined, and some genetic predisposition. So in those that are not clearly hereditary, sometimes there's also something in the genes still that, when combined with the environment,